Having some difficulty driving through our left hip, pain inhibition, post-surgical, whatever we're doing. We're having some issues getting either down into a lunge position or some issues kind of stepping up and getting that leg drive. We're going to get a little bit of help from our opposite arm and our back leg. So this could just be like roughly a countertop height. Ideally, we have an opposite hand down for a little bit of stability to get kind of cross pattern going. We're going to use this back toe to give a little bit of boost up and down as we go through the motion. So first thing we want to always think about is our tripod rooting. Big toe, little toe, heel, roughly even distribution. When we're doing this, we almost want to feel a little bit more hip push. We don't want to feel like a slide forward to bounce off our kneecap. We want to think it's more of a push right through the foot, so at the end of the motion, we'd be able to balance, not be kind of flinging ourselves forward. So as we do this, we want to set up. We're going to sit down into the hip. Think of a crease down, almost sitting down into the floor or slightly behind to the wall behind you. So we're going to sit down into there to whatever depth we want to hit. And we can use a little bit of pressure from the hand, one or both, or ideally just the one here, and a tiny bit of pressure from this toe to help us drive back through, with most of the initial push driving through the left foot, the forward one we're standing on, or maybe a slight bias into the heel to get a little more posterior chain drive as we get through. So we're going to be through here. You either have full foot down, ball of foot. Eventually want to get up onto a tiptoe on this side so we can use less pressure. So we're going to be through here. Sit down into the hip. Foot is set. Drive through the middle of the foot, slightly more heel. Drive back up with just enough help from the hand and the foot. Over time, we want to go from like a full hand to fingertips and eventually wean off down to like a little pinky. And we can go from ball of foot on the backside, eventually getting up the tip of the toe, and then hands free until we can get the full motion up and down. So major points would be, make sure we're thinking as we're driving up through, like we'd be able to balance at the top. We don't want to make sure we want to make sure we don't get a big quick forward push, so we're just going to bounce off our kneecap, because that's going to help our quad, but it's not going to really help our posterior and lateral hip to give us a little more balance and drive. And give that a shot. So hope that helps, and have a good day.